Hello everyone, welcome back to the Newbie Doctors. Today we'll be having the second part of the heart lecture. We hope that you enjoy as you watch.
And as I said earlier on, we have the valves of the heart. There are 4 valves that are located in the heart, which regulates blood flow through the heart. So what they mean by regulating of blood flow is that usually these valves are closed, but in order to let the blood flow from the atrium to the ventricle and out of the heart as well, these valves will open to allow the passage of blood. So we have the tricuspid valve, which regulates blood flow between the right atrium and the right ventricle. And then we have the pulmonary valve that controls blood flow from the right ventricle into the pulmonary arteries, which carry blood to the lungs to pick up oxygen. We also have the mitral valve, which is also known as the bicuspid valve. This valve lets oxygen-rich blood, which has been oxygenated in the lungs, to pass from the left atrium to the left ventricle. And then we have the aortic valve. This opens way for the oxygen-rich blood to pass from the left ventricle to the aorta. So this is also a picture showing us the location of these valves. As I said earlier on, these valves open to allow blood to pass to the next chamber or to the next, like, let's call it like a container where they stay till they go to the next point of action. So as you could see here, we have here the right atrium and the right ventricle, the left atrium and the left ventricle, and we could see here we have the tricuspid valve. Why it's called tricuspid is because it contains 3 cusps which open up. They're like flaps that open up to allow the passage of blood into the right ventricle. So it's called tricuspid because there are 3 flaps that would open. They're called cups. And when it opens, blood comes in here and goes out of this ventricle through the pulmonary valve, and from the pulmonary valve it goes into the pulmonary arteries, into the lungs, gets oxygenated, is brought back into the left atrium here, and then it opens up at the mitral valve, which is also known as bicuspid because 2 flaps here. We have 2 cusps that open up. So here we have 3 on the right side, we have 2, which is the mitral valve on the left side, and then it goes into the left ventricle, and the left ventricle will also open up at the aortic valve to let this oxygen rich blood go into the aorta, which distributes the blood around the body. Now we have the walls of the heart. The walls of the heart are basically layers that line the heart from the inner part to the outer part, and we have 3 of them. We have the endocardium, we have the myocardium, and we have the epicardium. I'm sure if we know like all them Greek or Latin words, we know that endo is inside, while epi could mean outside or around. But I'll go on to explain further. We have the endocardium, which is a thin layer that lines the inner parts of the walls of the heart. So this is found in the innermost part. The endocardium is found inside the heart, lines the inner parts of the heart. The myocardium is found in the middle. It's the middle layer. But what is special about the myocardium is it's also a muscular tissue. So when we hear of the cardiac muscle is the myocardium. So as well as being the middle layer, it's also the muscular layer of the heart. So we have the myocardium, myo as in muscle, cardium as in the heart. So we have the myocardium, muscle of the heart, and we have the epicardium. Epi meaning outside, surrounding. It surrounds the outer part of the heart, the external part of the heart, and it's also formed by the serous pericardium. And if we know the meaning of peri means around. So this epicardium forms like the outer cover that surrounds the outer parts of the heart, giving it its covering. And now we have the surfaces of the heart. We have 5 surfaces of the heart. We have the anterior surface, we have the posterior surface, the inferior surface, we have the right and the left pulmonary surfaces as well. And then we have the borders of the heart. The heart has 4 borders. We have the right border, we have the inferior border, we have the left border, and then we also have the superior borders of the heart. And now we have the innervation of the heart. There are various nerves that come together to supply the heart, and they are usually called the cardiac plexus. So the heart does not have just one nerve, it has a combination of nerves, and these combinations come together to form the cardiac plexus. And then we also have the conduction system, which is very, very functional in the heart because it supplies the heart with specific signals that allow the heart to continue beating. So what happens in this conduction system is that there are several nodes. We have about 5 of them that come together to form this conduction system, and it is through these different nodes they pass on signals to themselves from the beginning to the end, and these signals that are generated is what keeps the heart beating, and the heart is able to keep up its function of pumping blood. And the conduction system on its own is a topic, so I won't be going into it deeply here, but if it is something that you would like to know about, be sure to let us know in the comment section, and we would make a video for it as soon as possible. Now going to the clinical pathologies, we have different pathologies that could affect the heart, but in this video and for the sake of this lecture, we'll be discussing briefly the common types that we could find in the heart. And first of all, we'll be discussing aneurysm, which is basically the swelling, the abnormal swelling of an artery or vein resulting from weakness in the wall of the vessel. Typically, they are found mostly in men and especially older men, because when people grow up, as they grow up, their muscles become weaker and less functional. And if you remember, in the beginning of the lecture, when I was speaking about the chambers of the heart, I spoke about the left ventricle having a thicker wall. So this is what happens in case there is no thicker wall in the left ventricle, aneurysm, because that chamber has more work of pumping, like a larger quantity of blood, or should I say it pumps blood with more force. Just imagine a closed tap that you open and the tap has been on for a while, but something has been blocking it. When you remove that thing that is blocking it, it's going to come out with a severe force. That is the same thing with the vessels. We know that the vessels are usually like tiny, like tube-like structures through which the blood goes through. In case of aneurysm, when the blood keeps flowing and there's a lot of pressure moving this blood and there is a weak vessel, at a point the wall of the artery will kind of expand or swell to contain this pressure, to allow the blood to be able to flow through. So in order to contain this pressure, it keeps a bulge so as to allow more blood flow. But what happens in the case of aneurysm is that that swelling does not go back to normal. That bulge does not return back to its normal shape. So to say, it has lost its elasticity. So that is why aneurysm develops. It causes like a swelling in the walls of these vessels due to the weakened vessels, due to the weakened walls of these vessels. I do hope you understand. And usually also, it's usually found in the aorta. That is why we have aortic aneurysm, and there are also different kinds of aneurysm, but for the sake of this lecture we'll be mentioning just the aortic aneurysms. And as you can see down here, we have the causes, which may be due to weakness in the wall, due to hypertension or atherosclerosis, which I'll be discussing as we go further in the lecture. So we have other clinical pathologies, for example hypertension, which is increased blood pressure. Why I mentioned this as the causative factor, or one of the causative factors of aneurysm, is that in case of increased blood pressure, the blood will be pumped with an increased force. And as I explained already, if the walls are weak already, the walls will expand to contain this flow of blood that is coming with an increased pressure. The problem is that these walls never return back to normal because they have been weakened and they have lost their elasticity. So I do hope you understand. And then we have arrhythmias, which is abnormal rhythms of the heart. There are congenital heart diseases, which is abnormality in the heart that develops before birth. These congenital heart diseases, they develop during pregnancy due to different factors. And also there is the coronary artery diseases, which is narrowing of arteries of the heart due to atherosclerosis, for example. And atherosclerosis is the thickening of the artery wall as a result of infection and accumulation of fats. So usually what happens in atherosclerosis is that plaques are formed around the walls of the arteries, which will cause like a narrow passage. You already know that these vessels are like tubes, as I mentioned earlier on. So just imagine when a tube becomes tight because of lodging of particles in the wall, it becomes even difficult for blood, or for blood to pass through. And when it becomes difficult, it require a like an higher level of pressure to push through this thickness that has occurred due to the accumulation of fats and other particles that have been deposited there. So just imagine, as I explained earlier on, the hypertension, increase of pressure. When pressure is increased, it takes more force to push the blood through. The vessel increases in size or causes a bulge in the wall to accumulate for the lack of easy flow, and that's it. The wall cannot come back to normal. Aneurysm develops. Same thing here, atherosclerosis, which is on its own a very, very severe case of heart pathology. And then there is cardiomyopathy. Remember, I spoke about the heart muscle earlier on, the myocardium. This cardiomyopathy occurs when there is an affection of the heart muscle. It could be from inflammation, or it could be a defect. There are different types of cardiomyopathies, and there are different ways in which the heart muscles can be affected. One way is through infections or inflammations, and in case of inflammations we could hear of myocarditis. And also for cardiomyopathies, there are several times, as I said earlier on, but what will be happening here is that we won't be able to be treating each pathology one after the other with all it entails, because there are broad topics on their own. So if there are any of these clinical pathologies you would like us to discuss, please do also let us know in the comment section, and for sure you will get a video on it. And lastly, there is the heart failure, which is a condition in which the heart does not pump blood as it should. So guys, we have come to the end of today's video. If you stayed till this point, thank you for sticking by, thank you for watching, and let us know in the comment section if you enjoyed this video. Let us know if you have questions on this topic, or if there are other topics you would like us to treat. Do else let us know in the comment section or in our DMs, or send us a mail. Well guys, till our next video, bye bye.